Hey, good evening. I am Margaret Hefferly. I'm the chair of Council One of the Family Support Councils. Sometimes there's some confusion. Kyoko, who is a paid staff member, not getting the big bucks though, is from the New Jersey Council on Developmental Disabilities. The Family Support Councils are a project of NJCDD, and they were established by the Family Support Act of 1993, which established the now 10 regional councils that exist today. The act said that families must have a seat at the table. We are considered the voice of families and of our loved ones in the intellectual and developmental disability system. Council One represents Morris, Sussex, and Warren counties. One of the points of the council is to provide information to families, to gather input from families. We take notes at all our events, and to provide that input on our committees in our annual report to the governor. So we sit on a lot of committees. So we have regular discussions with state leadership to ensure that our voices become part of the decision-making process to improve the intellectual and developmental disabilities service delivery system. We have monthly meetings like this with local families to share information and identify issues to guide our advocacy efforts. We also have quarterly statewide forums on specific issues to empower families. So there's a lot of ways that we provide information to families. And like I said, this is one of them. So we have two committee members here tonight who are going to be able to provide us just an update on two of our important committees. One is the DCF Collaboration Committee. That's the Department of Children and Families. Most people know the service provider system as Perform Care. And then the Family Advisory Committee, which is the Division of Developmental Disabilities. Some family members sitting on those committees to provide input. So Gabrielle Bohan is going to talk about the one for children regarding Perform Care.
Good evening, everybody. So we meet with representatives from the Children's System of Care, which is within DCF. As Margaret said, most people know it by Perform Care. We have a representative from each of the 10 regions. We meet monthly with the administrators of CSOC, and we meet on the other months within ourselves as like a work group. Right now, our goals that we were talking about with the administration is to develop a case management system for those families who have children between the ages of 3 and 21 with intense needs, trying to get them a little more support going through that system and managing all the services that they're entitled to. We're also going through and trying to identify the services being offered and seeing if they are actually serving the families in the best way. And then we're also reaching out to families and trying to help the families raise their voice, communicate better with CSOC and Perform Care representatives, and how to access the system. So we're trying to smooth out the edges. Those are our projects for the coming year. And hopefully we will have good news by the end of the year, and some of these will already be in place.
Thanks, Gabrielle. Okay, and now Alicia Teddo is going to talk about what the Family Advisory Committee is doing.
Hi, I'm just going to give you a rundown of the last few months. The Family Advisory Council meets monthly. There is one representative from each of the regional family councils, and then there are 3 appointees that are just family members who have a specific interest in this, and we meet with Jonathan Seafried, and a couple other people are being will come in and out of the meetings. Diane Flynn, Robert Artis, and basically that's it. And like I said, we meet monthly and we alternate agendas. So 1 month is the agenda from DDD, and the alternating month is the agenda from the Family Advisory Council. And okay, so I'm gonna just run through the last couple months. Back in September, DDD developed a focus group to take another look at the New Jersey Comprehensive Assessment Tool, the NJCAT. And so they are working on that focus group right now. Jonathan has been working on developing a specific criteria for allowing overtime for self-directed employees, which had been allowed through the public health emergency, but when that ended in November, so did the overtime. So, but Jonathan and DDD do recognize that sometimes families will need overtime for their self-directed employees because other people go on vacation or somebody's sick, and that's how it works out. So he's still working on that, and at the last council meeting, he said that we would have some response probably by the end of the first quarter this year. One of the other topics that has gotten a lot of feedback is person-centered planning. And we've been talking about having training courses for parents so that they can understand how this should be person-centered. This would also include support coordinators who have had some training on person-centered planning, but may not be aware of all the different tools that are out there to assist with that. So that's something else that we've been working on. There is a health and safety subcommittee. They work mostly on health and safety issues in group homes, which leads me to one of the really hot topics from our last meeting. I don't know if how many of you came across the article called Alone, Autistic, and Afraid. And it was an article that was published earlier this month. And it was about how the system failed a young girl who's still in the DCF system, but is in a group home. And so we talked about how we prevent that on the DDD side, what kind of oversight is given to group homes, what guardians and caregivers and families can do to help ensure that their children are in the best possible place. They've released several requests for proposals for new group homes. One of their biggest focuses right now is on getting a dual diagnosis group home going. That is for adults with developmental disabilities who also have a diagnosis of mental health issues. And that's pretty much, what we've been discussing in the last few meetings.
Okay, thanks, Alicia.
Sure.
So just one final word. Council One is always looking for new members. Come join us at our monthly meetings and find out what we're all about. Our next meeting is different. It's on a Monday, March 18th, at Wegmans Cafe in Hanover, New Jersey, and Paul Aronson, the Ombudsman for Developmental Disabilities, will be with us. If you want to be added to our mailing list to find out about all our meetings, send an email to RFSPC, which stands for Regional Family Support Planning Council, number one, not just one, not the number sign, and then at gmail.com. So it's now my pleasure to introduce Amy Tackliffe, Senior Analyst with Catastrophic Illness and Children Relief Fund. I'm lucky enough to work with Amy on my day job as a case manager with Special Child Health Services. Welcome, Amy.
Thank you, Margaret, and thank you for having me. I'm always excited to do presentations for my program. My name is Amy Tackliffe. I've been a licensed social worker for the last 15 years, and I have worked for Catastrophic Illness in Children Relief Fund for about that long. Prior to this, I worked at DDS, the Division of Disability Services, as well as with Mentor, what used to be called Mentor, I believe is now called Neuro Restorative. I have to say, you know, I enjoy my work, and but I kind of wish more people knew about us already, so I didn't have to talk to everybody, because it feels like nobody knows about our program, and we're wonderful. So I'm going to share my screen with you. Okay, is that working?
Yep.
All right. So I often like to say that our program is the best program with the worst name in the state of New Jersey, because we do not just serve kids whose illnesses would be considered catastrophic. Oftentimes we miss out on people because of our name, I feel. But we have been around since 1988. So we've been around for over 35 years with, like I said, bipartisan support and sponsorship. Oh, hey, that's not supposed to happen. Hold on just a second. Okay, I see what happened here. My apologies. Let me try that again. Okay, let's try it this way. Moving on. We were created in 1988, and we have awarded at this point over $200 million to families throughout the state of New Jersey. We are governed by a commission. Our commission determines the eligibility of cases every 10 weeks. And these are usually volunteer public members. And then there are some people who are there because they serve in a certain office or in a certain department or division. We are funded actually by New Jersey businesses. $1.50, businesses have to pay $1.50 per year per employee for all businesses that are subject to New Jersey unemployment compensation law. And in 2022, which is the last one we had for this slide, was we had over $9 million around that amount. Here's the great stuff. We can serve any child with any condition at any income level. We do not have any limits based on diagnosis, nor can you make too much or too little to qualify. For us, a child has to be under the age of 22 when they incurred the expenses for which they're going to request reimbursement. They have to be legal New Jersey residents for at least 3 months prior to application, and a legal resident of the United States. This would be somebody with a birth certificate or passport, but also kids with visas and refugee status, things like that. The child's condition, however, does not need to be terminal, severe, chronic, or even permanent to be eligible. This is important because, as I said, when you have a program, it's called Catastrophic Illness. Most families, many families, will say, "Oh, well, my child's condition isn't that bad. They just have fill in the blank." But the terminology that we use when we use the word catastrophic, it's a financial definition. So as we're going to see below, you can't make too much or too little to qualify, because while you can't make too much money, you can have not enough expenses to qualify, because eligibility is based on the amount of expenses in a given 12-month time period. And it would have to be 10% of the family's annual income up to $100,000 and 15% of everything over that. So what I always say, my example is that if you made $50,000 a year, you'd need $5,000 to qualify. And if you made $150,000 a year, you'd need $17,500 to qualify. And as you'll see, I mean, we cover quite a number of things that can set some families back. Okay, a few things. The expenses have to exceed that amount. It has to have been incurred first prior to applying. We are a retrospective program, so we only reimburse for things that have already happened. It also has to have occurred within the past 7 years, 7 years prior to the date of application, and before the child's 22nd birthday. However, the child can now be older than 22. There are some 28 or 29-year-olds, I guess, maybe 28, who are 28 now, who had expenses that were 7 years prior that we could still assist with. Each application has to cover a 12-month consecutive time period. So for some families, that would be relatively easy to determine. It's like, well, we only had one expense. It was a home modification. It was a vehicle. It was something like that. And, but we still have to do, okay, well, what 12-month time period should we use? Did you have other expenses that we could, add in? Sometimes it's not as clear because, as many of our families, are getting ongoing services, or services are changing every year. So they may or may not be eligible every year. But it does have to be one application is one 12-month consecutive time period. And every child has to have their own application. So we can't, if there are 2 children with medical conditions or mental health conditions in the home, we can't add them all together to bring up eligibility for that family. Each child has to meet eligibility on their own. But you can apply for multiple years at a time. So whether you have 1 child or 2 children, you can apply for up to 7 years back. And if you had the enough expenses and the paperwork for it, you could really right now submit 7 applications for the last 7 years. Okay, just a few things. We are not an entitlement program. Even if that item or service was awarded in the past, the commission reviews every case individually. There is never a guarantee of award. That can make it difficult for some families because, they may say, well, we wanted, to have this treatment, or we wanted to have this done, we wanted to know if you could help us. We can always say, well, potentially, yes, we have helped people with something similar in the past, but we can never say yes for sure. Applications are processed in the order in which they're received. That process can take a few months. We have right now we are working on a new system, which we're very excited about, where families will be able to submit things online. But for right now, our process is that families, when they apply to us, they have to go through a fiscal process first. So families will need to send in a few basic things: their income for the year that they want to apply for, a copy of their insurance card, and something proving their child's residency. That's the first part. Once we have all that, it comes to us, the analyst, and we do the rest of the work, which is, verifying bills or expenses and getting, documentation together. So it can take a while. In addition, the commission only meets every other month to decide on applications. So even if I finished something today, it's not going to be heard till the next commission meeting in April. And then requests for ambulatory services. So that's things, obviously that are just not inpatient things. We see, therapies and things like that from out-of-network providers may or may not be eligible. It depends upon the child's insurance coverage. It depends upon, was it urgent, emergent, or inadvertent? Did you not mean to use an out-of-network provider? Or was there another reason? Child could not wait for, this treatment. Because the commission reviews things on a case-by-case basis, they can always make exceptions, but that's just something to keep in mind. Okay, this is the part I like. Potentially eligible expenses. We put the word potentially there. Things that we see quite a bit of. Hospitals and physicians. We may ask the family, because we are a payer of last resort, we may ask the family if they make, if they could potentially qualify for charity care and it's a hospital, we may say, well, did you try them first? But, we do see quite a number of hospital and doctor bills. Therapies can be, like things like speech and occupational and physical therapy. But our commission also considers most therapies that you can be licensed to perform in this state, we potentially can consider. That's how I usually put it, because we do rely heavily on credentialing. So things like acupuncture, or music therapy, or aquatherapy if it's done by a PT or OT, or there's a number of things. Hippotherapy, horseback riding, that's one that we see a lot too. Those kind of things we can potentially help with. Mental health services of all kinds, inpatient, outpatient, seeing someone here and there, any range, anything in that range of mental health, we can help with most mental health services. Residential treatment, we do see a lot of applications for kids who are in treatment or in rehab, for different conditions. There are mental health things, there are kids who are in eating disorder programs or addictions services. So I tend to call that one of the, unfortunately, like big ticket items, because a lot of times, insurance either won't pay or won't pay all of it, or will only pay a portion. And, so those bills tend to get pretty big, pretty quick. Disposable medical supplies, that's things like wound care and tubing and things like that, but also wipes and diapers for kids over the age of 3. We consider 3 to be the cutoff for that. Addiction treatments, medications, as well as medical cannabis for kids who have a card, for it. That can be, the medications can be just regular over-the-counter things if they're being used on a regular basis. So like, everybody needs Tylenol once in a while, right? But if your child needs Tylenol every day, or multiple times a week, then that would be more of an ongoing use item that we would probably consider assisting with. And of course, prescriptions, compounded medications, we see a lot of that. Some of the kids that we serve are, still getting tested, they're doing diagnostics, or things happen, they need an MRI, they need an X-ray, that kind of stuff, blood work. Modified vehicles. We can assist a family with the purchase of a modified vehicle, a vehicle that is modified permanently for safety or access for the child, that is registered to the parent or guardian. We can reimburse up to $7,500 toward the vehicle itself, the chassis, the body of the vehicle. But we can reimburse the full cost of modifications, which, as many of us know, is sometimes more than the car itself. We only assist with vehicles once per lifetime and per household. So while a family, if we helped a family 5 years ago with a modified vehicle, we can't help them with that vehicle part again, but we can look at the modifications repeatedly until the child turns 22. Home modifications. The family does have to own the home in order for us to consider it to be, an eligible, excuse me, an eligible expense. And it has to be modified for safety or access. Can't be like regular repairs or kind of upgrades. We can reimburse up to $25,000 per application, which would be like per year for home modifications. Some families choose to kind of break out their home modifications so that, maybe if they were creating a separate space for an older child that's using a wheelchair out of the garage or something, maybe the first part of that job is the bedroom, and then the second part of that job is the bathroom, the accessible bathroom. Once we might potentially be able to say, okay, well, if the contractor finished the bedroom on this date and then finished the bathroom at a later date, we might be able to break that into 2 applications and kind of maximize the benefit for the family that way. But home modifications are another thing that we see a lot of, and it is another big ticket item. Home health care or respite, if it is provided by someone who is licensed or certified as a home health aide or a nurse or, something like that. If it appears to be more like babysitting or something like that, that's different. That's not as much, that's not really more of, really a medical or mental health condition. It's not helping with that, so we may not. Durable medical equipment. So that's all, the wheelchairs and the walkers and, standers, potentially adaptive strollers, depending on the child's condition. Anything that's, really essentially just for the use of the child, that is, specific to assist them with their own condition, we could potentially consider as durable medical equipment. Eyeglasses would actually go into that as well. Hearing aids, things like that. Travel, we can do mileage. We reimburse at 47 cents a mile. Tolls and parking. We do not reimburse for gas or food on the road. We can reimburse hotels and flights if the child had to go out of state or, if there was an extended stay somewhere. And then ambulances, medical air travel, and more. Yeah, well, and I put that there because I really do want people to, to know that if you're not sure, just ask us because, sometimes we don't even know, but like, I'm not sure what the commission will say about that. Let's see what they say. So, when in doubt, definitely ask. Okay, things that are generally ineligible. In utero expenses, we see a lot more, and more the kind of surgeries that are done while the child is still in the womb. Some heart conditions can be repaired that way, or spina bifida surgeries. So unfortunately, right now, we do not consider those to be expenses for the child. They are still considered to be mom's expenses. And we do not pay for birth expenses for mom, unless mom was under the age of 22 and had complications of some kind. That if it was just a normal birth, we generally don't consider that. We don't modify secondary homes like, at the house down the shore, or homes that are just not owned by the parent or the guardian. Anything that we consider to be normative, things you need, it's things that everybody needs, so, rent and food and clothing. Food, when I go a little further down, you'll see we may be able to assist with some specialized foods, but it does depend. And the same thing with clothing. We don't generally pay for clothing, but if it's specialized in some way for the child, we have sometimes made exceptions for that. For children, AFO socks, ankle foot orthotic socks, UV blocking kind of shirts and things like that for kids who have sensitivity to that. A few things. We again, gas, food, and incidentals and travel we don't reimburse for. We don't generally reimburse for supplements or vitamins unless they are directly treating a condition. So, if the child has a vitamin D deficiency, then clearly, vitamin D is what the child needs. That's a direct treatment. But if it's just, kind of multivitamins or supplements of some kind, we don't generally consider that. Food, we can consider like specialized formulas for children who, require that, or feeding tube, supplies and food. Um, we don't generally consider things like keto diets or, like specialized foods like that. But again, we're not sure all the time either. So, if you're not sure, ask. We'll see what we can do. Anything that is educational, recreational, or legal in nature, we don't reimburse for. And with legal expenses, even if it's for guardianship, which is, kind of specifically for the child's needs, guardianship or things like that, we don't consider it. Cosmetic surgeries, most of them, because sometimes an insurance will say it's cosmetic and we'll say, well, maybe not, unless it's purely cosmetic, in which case, no. Generally, treatment's not approved by the FDA. But again, we can assist with, like travel and things to experimental surgeries and experimental treatments. There, again, if you're not sure, ask, because there are some things that we are able to consider, but overall, vision therapy, generally speaking, not covered. Wilderness therapy, we may be able to break out a portion of the expenses from wilderness therapy. We potentially can reimburse for the one-to-one treatment with a psychologist or a licensed clinical social worker or something like that. But the bulk of the expenses, like the room, the board, the other things that they treat, the other things they have, like the groups and such, we don't reimburse for. And anything out of country, we generally don't pay for. I always put some exceptions. There's always some exceptions. Okay, reimbursements, for some expenses have annual caps. So for each application, that 12-month time period that I was talking about, each application, we cannot reimburse more than $100,000 for any application. Speech therapy, and by the way, some of these caps are being revisited right now, so they may change in the near future, but currently, speech therapy is capped at $3,000 of reimbursement. We will consider, for the most part, the entirety of the bill, though, towards eligibility, towards that 10% I was talking about that you need to be eligible. So if you had $6,000 in speech therapy, that $6,000 would go towards your eligibility, but we only give you back $3,000. Applied behavioral analysis, or ABA, $6,000. As I said, the modified vehicles, the chassis is $7,500, and home modifications are $25,000. These are all per application. Okay, yeah, so the initial documentation that we will ask for is the proof of legal residency, the health insurance cards, income. We ask for generally federal taxes or pay stubs, sometimes profit loss statements, pretty much anything that comes in regularly that can be used as like expendable, cash, we would consider income. Not things like WIC and things like that. But anything that can be used as actual money. And then also we ask for a declaration of any lawsuits, fundraising, or special needs trusts. None of those things mean that the person will not receive assistance. But if there's a lawsuit related to the medical condition of the child, we need to know that, because we are a state agency, and we would we potentially may want to have that back, the money that we've put out, similar to Medicaid, if there is a lawsuit pending. Fundraising, I mean, if it was done for the same thing that the family is applying to us for, we may remove it. If it was not, we may not. So it does depend heavily on the situation. Same thing with special needs trusts. Sometimes things are excluded from it, or, there's just nothing in it, like it was set up and there's no actual funding in it. So we ask people to tell us about these things, but it doesn't necessarily, mean that they're going to be ineligible. And then we do a referral to Special Child Health Services at this point, which is we work with Special Child Health Services so that each application, each family at least has a contact, that, is checking in with them, like, do you need help, with the application? Is there anything else you need? And just to kind of fill out, what we can do for them, because we can't help with everything, but case managers are on it. They know they know other things that these families can get. So, that's one of the perks. One of the many perks of our program is that the families get in contact with the case manager as well for every application. We will ask for medical documentation, obviously, from a physician. We ask for invoices or bills. These have to be itemized bills, and for physicians, hospitals, therapies. For the modified vehicles, we need a bill, but also registration, photos of the inside and outside. If the family took out a loan, we would need that information, because we will pay the bank or the loaner first before giving the family any money back. And an invoice that has the modifications separate from the chassis, so we can see, how much to apply to each. Most of the mobility dealers in the state, all of them, I think, know us. So they're very happy to provide that. And they're very good about providing it. And for home modifications, we ask for photos. If you can do them before, great. If you didn't, that's okay too. A contractor's invoice. We may go out to the families to see the home modification, depending. I mean, if it were something very simple, like, a ramp, that you can take a picture, I'd be like, that's a ramp. But if it's a if there's multiple steps to it, or if it's like there's multiple rooms involved, like we as the analysts may want to go out and do a home visit with the family to take our own pictures and kind of, see it for ourselves. Proof of payments, if applicable. I want to stress that families do not have to have paid for anything in order to be eligible. They just have to have incurred it. So that's easy enough, when you get a bill from a doctor, or a hospital, it's you don't necessarily have to have paid it, but often there are things that families apply to us for that, nobody's just going to give it to them, or do like the home modifications. The contractors are not probably going to be like, no, it's fine. Don't pay me until catastrophic illness does. Some families do have really no choice but to pay it ahead of time. But for the purposes of our program, it just has to be their responsibility already. It doesn't have to be paid. And in some cases, depending on what they're applying for, explanations of benefits or denials or appeals from their insurance company if they have submitted these things. How to apply. This is our current website, and they could click on how to apply. Right now, as I said, we're working on a new system where families will be able to upload things themselves, but this right now, there's no way to do that. So families will have to kind of go online, fill out the basic information, and then we will get in contact with them, and ask them for the rest of the documentation, which they can send by mail or fax or email. If families prefer, excuse me, prefer a paper application, just give us a call, or that's our main email address there. We can send you one as well. We can email one as well, like an electronic copy of the paper. This is our general contact information. We are based in Trenton, in downtown Trenton, but we serve the entire state. I always tell people spread the word, because we are a great program, and I feel like there are so many more people could be served by this program than are being served. And I really recommend, letting families know about our program. If you want us to present at conferences or seminars, if you think it would be good for us to do like an exhibitor table somewhere, like the professionals and families know like where things are. And if you didn't like me, that's fine. I mean, I'm not everybody's cuppa. We have other staff. And then you can also visit, and share our Facebook page. And that's it. That's me. I will stop sharing for right now. So I understand that you can provide this information to the rest of the group. I realize there are questions in here.
Yes. So the first question, um, how do you keep track of all the expenses, mileage and tolls? What's the
Oh, it's
best way to do that for families?
That's a good question. Yeah, they don't have to do the actual math. They can, just either on their phone or on something, or even if they prefer, just send me the addresses. This is my home address. This is the address that I went to. We go here. We go to this therapy 3 times a week. The tolls, we do need either a receipt or the Easy Pass statements. We can't just, kind of take people's word on that one. But for the most part, yeah, and parking too, we need a receipt or often, just the bank statement or credit card statement. Often those will say, chop parking or something like that. Like that may, and I'll see that the date matches up with whatever has been sent from Children's Hospital or, things like that. So yeah, it just giving us the addresses is fine. Or some people prefer to send the maps, this is how far it was from my house.
So, but all the other expenses, just kind of put them in a nice neat pile and send them over. Is that
Right.
what you're saying?
Yeah. Yeah, the best way, ideally the best way for us, because as the analysts, our job is to kind of sort through everything, and you definitely get families that run the gamut, of course, right? So there are people who send things piecemeal, there are people who send things all in one big binder, there are people who send everything in like a trash bag, like it's everywhere. But it's fine because that's our job. But it is helpful to us to group by provider or type, because that is like, if you have seen, 20 different providers over the years, or I'm sorry, over the year for your application, and I get, a bill from this one and then the EOB for that one and then the payment for another, and they're not kind of together, that takes more time, which again, hey, that's what they pay me for. But it may end up taking, enough time that it might affect what commission meeting someone gets into. So yeah, if it's an option, if I had my druthers, families would put things together by provider or type. Yeah.
Are out-of-state mental health residential treatment programs potentially covered?
Yes. Yeah. Doesn't matter if it's out of state. It just has to be licensed to be doing what it's doing, which most of them are, licensed as mental health providers and wherever they are.
How do I go back the last 7 years? My daughter is 6.
You don't have to go back 7 years. Yeah, I mean, you can go back as far as 7 years, but that would not help you. But you can definitely apply for the entirety of her 6 years. If every year you think you had enough expenses, I would for sure apply for all the years. But if you prefer, you can start with just 1 year, like 1 year, maybe it was bad. Like it was a year that she had a lot of this or a lot of that, or she needed more equipment. If you have a particular year like that, you can start there. If that was 2020 for you, start there and then just gather expenses. And if you think it meets that 10% of your income, and then 15% over $100,000 a year, then yeah, for sure. You can apply all 6 years.
Amy, you know what I tell families sometimes is you can go to your pediatrician and get a printout of what you've paid.
Yeah,
You can go to the pharmacy and they'll give you a printout of what you've paid. Oftentimes I'll say, if you see a certain doctor for something, you'll see a date of service on that
right.
day. And then you'll get a second one where it's like, okay, insurance is going to pay a little more. So
Hmm.
whatever. And then like by the fifth one with the same date of service, you'll finally say, this is what you owe. And then that makes it a little clear. So I would clip them together by date of service.
That's great. Yeah. And I always say, go for the low hanging fruit. Like you said, the pharmacies, can provide you with a list from between any date and any date, so if you wanted to
Hmm.
put in, for a couple of years, you just ask them for all those years, and we can assist with that. We
Same
don't
thing.
necessarily, go ahead, I'm
Sorry,
sorry.
look at their calendar, look at your checkbook, look at
Right.
your bank
Yeah.
credit card statements.
Because people forget too, right? I mean, especially when you're overwhelmed with like, I'm just paying things, or I'm just not,
Right.
or I'm putting things in a pile because I can't look at it. Like, it gets to be too much. But whatever you can do to make it easier on yourself, put it on the providers. You already paid them. you know, like I
Mhm.
always tell them like, yeah, you know, families like, well, I don't want to ask my therapy provider, you know, for the notes or, you know, whatever for, so I'll be happy to ask them, but just keep in mind that, you know, like that's part of what you're paying them for, you know, are these records and keeping that. So, I will hold the provider's feet to the fire. Yes, I will.
Is the income determination before or after taxes, meaning gross versus net?
It is, well, yeah, it is gross. Yeah.
Okay.
Net,
For
lied to you, net, all of it. It's all of it before taxes.
okay, so it's before taxes, that's
Yeah,
gross.
yeah, gross.
So, for home modification, is it by reimbursement?
Yes, unless you can get the contractor, whoever did the work to hold that balance. We have had that happen a few times where the contractor said, it's fine, I'll do the work, and then when you apply to catastrophic illness, they can pay me. It's rare though, you know, but if you can, yeah, we can pay a provider. Or a contractor, or yeah, we can pay someone like that.
And
Okay.
sometimes people will just start a loan and then get paid back for that.
Yeah, or even, you know, we can consider personal loans. Like, I mean, we have had families who, you know, the grandfather loaned them money, or, you know, like somebody else loaned the money. If you can provide us with a loan statement, you know, like something written up that is signed by both parties and includes both parties, you know, contact information and the social security number of the person we're paying, because that's how the New Jersey Treasury pays, is by a social security number. We can, as long as that's signed and we can see, oh, look, this check did come from this person who signed this, or, you know, this letter. Yeah, we can even do that.
My son is 28, going on 29 in 3 months. He was diagnosed with autism when he was 2. How do we count 7 years?
I think your son is actually just beyond where we could probably assist, because if to go back, he said he's almost 29. That would mean that, you know, 7 years ago, he was almost 22. So, right, you know, so I think unless there were a few months in there towards the end of his 21st birthday, I think unfortunately the timing just works out that we wouldn't be able to help.
Do you count SSI as income?
Yes, unless it does not belong to either the parents or the child that's applying. So, you know, some families, like I said, will have multiple kids, or someone else in the house is collecting Social Security that is not responsible for the child. We don't consider that. So for another sibling or for grandma or somebody else, we don't consider that. But if mom, dad, you know, or guardians, or the child themselves is collecting Social Security, we do consider it.
That was our
Can you explain how somebody's deductible will help get them eligible for an application?
Yeah, I mean, the deductible is, you know, really your out one part of your potential out of pocket if you have, you know, a deductible. Um, we we still reimburse, you know, for deductibles as long as as long as it reaches the 10% of your income. So co-pays, co-insurance, deductibles, all that um, goes towards that 10%, as long as it was for your child. So, you know, sometimes it's like, well, it's a family deductible and it was, you know, some of that was from another child, but
Mhm.
that's why we can't go by, you know, sometimes people will say, well, here, I met my deductible, and they'll send us something for the insurance that says they met their deductible. And I say, well, that doesn't tell me how you met that deductible, whose expenses were included in that
Right.
deductible, you know, so we need a little more than that. But yeah, I mean, overall insurances, it can be, when you get them to work, right? Can work
Mhm.
well, because it's a good record keeping. It shows kind of all the dates and the changes and, you know, things that were audited, or like, you know, like edited. Yeah.
Did you find that there were a lot more approvals during the pandemic due to job loss or things
You
like
know,
that?
I thought that would have been the case myself, but we did not actually see
Hmm.
any increase in applications over the pandemic. Um, if anything, I made maybe even fewer, you know. Maybe it's just it was pure overwhelm maybe for many people, but I think it's, you know, it's a process, and getting it started can be, you know, can be daunting. So I kind of thought that, oh, people have time now, like maybe they'll do that, but
Right.
it was not the case.
I don't think anybody has time now.
Yeah,
But I do have to say, I always tell them to call the family helpline because you guys are so helpful, helping families navigate and find a way.
thank you. Yeah, we did really try to, um, we do really try to be responsive to people. Oh, I see here that from the average time for applying the average time for reviewing applications right now. There's no wait. There used to, some people might remember, if people are thinking about it, we did have an excessive wait for a long time. We had people who would apply to us, and like we literally wouldn't put hands back on their application for 12, 18 months. Like it was ridiculous. But we got that backlog cut down, and right now there is no quote unquote backlog. So as soon as somebody's application comes in, it goes into our system and it goes right to fiscal. It starts right to that first step, to ask for all the initial information. How long that part takes really is up to the families mainly, because again, like we're asking you for things, and there's things it takes time to get, and sometimes, you forget or whatever. So then it doesn't get to us until whenever that gets to us, and then we have to ask different questions. We have to say, okay, so we also need this, that, and the other, and families have to get that together. So it's that process can take a little while depending, I mean, if it's just for one thing, if it's for a vehicle, I need like 3 things in addition to income, and then we're done, three, 4, 5 things. But when there's a whole year's worth of expenses that have to be kind of sifted through, that takes time. So there's no holdup in reviewing them, but there may be some wait in as we're working through the process, depending on how easy it is for families to get things together.
We have a new question that popped up. The process to apply can be challenging. You have people who speak Spanish or other languages to help the families.
Yes, Carmen Santiago is our bilingual staff person, but we do also work with a great translation agency for families who need any kind of assistance with any language at all. We do not have applications in that. However, in the new system that's going to be coming up, there will be an option to switch everything to, I think, several languages, 5, 10 different languages, so that the families will be able to read that at least if they apply online. Yeah, but if anybody's having any trouble getting in contact with us, let me know, like somebody send me an email, let me know, because I can definitely call somebody with, through our language services. They're very good.
So I had talked early on in the beginning that you guys send some funding our way. So
Mhm.
we're always happy to partner with you. And I am old enough to remember when the applications got mailed directly to us,
It's
and we
right.
would make a full copy of everything and put it in a express mail envelope and send it on over.
Yeah, it was a whole different process, and in all the time that I've been here, like I said, for about 15 years, there have been a lot of iterations of this program. There have been like, oh, let's have a 2-step process, and then let's have this process, and then let's do a mailer, and like let's do, but I think we're always at least getting better. I think we're always, making improvements. It's growth. I mean, it's not steady growth, right? Things, but I mean, right now I'm actually very encouraged by the potential for our new portal, and, make things a lot easier for families. Because right now, I mean, if a family sends us something, and they don't know for sure if we got it unless they ask us, or we have to call them and say, yes, we received it. But if they upload it to this new system, they'll be able to look at it and say, oh, here's what I uploaded, here's what I'm missing. We get a lot of calls about like, well, what else am I missing, or a lot of emails. You'll be able to see that right there. And I mean, we're still available for families to talk to, but I think it'll cut down on a lot of confusion that's really based in the fact that we were, almost an entirely paper application, and almost entirely paper operation till up to the pandemic. And then we kind of switched over everything to electronic for most of
Do
it.
you wind up getting a lot of incomplete applications?
Yeah, we do. We have to make them, ineligible for lack of documentation sometimes, so like families will, or make it inactive, like, so the family will submit some things and then we'll ask for other things. And, most of us have our rhythm where it's like, you ask a family for something and you give them, if you don't get an answer, you give them a couple weeks, a week or two, and then you're like, hey, maybe, we still need this, and give them a week or two, and they'd be like, hey, I need this and I need it by this date, and then if you don't hear from them, then it's like, okay, well, and we do try by phone, we try by email, we try by whatever we've got. But yeah, we do see quite a number that have dropped out just from lack of documentation. And I'm thinking too that this portal will help with that because, it'll also give families a chance to see what they're going to need to send in before they even apply, so they'll be like, oh, is this going to really work for me? Families might get frustrated too, or they submit these things and it turns out it's not quite enough to make them eligible, or, they'll be able to see that at least, kind of on the system. So that's my hope anyway.
Right. Yeah, that's why we tell, families, particularly when they do have some major surgery coming up or something like that, start your record keeping now.
Yeah,
Keep everything filed and copies of everything
it's good advice.
to make.
Yeah. Even if you just put it, I always tell you just put it in a shoebox if you have to, or like in a basket. Just if you can't look at it right now or whatever, just put it all, but keep it all in one place so that when it, when the time comes, you won't make yourself crazy. You may have to open a bunch of unopened envelopes, but you you won't make yourself crazy. At least most of it'll be there in duplicate and triplicate.
So it's always nice when we see the letters come out that say, a certain family has been approved and they're going to be receiving a check. And I know the families are really grateful as well.
Yeah, thank you. I do. I love talking to families. I love meeting with them. We get a chance to see a lot of families at some of the events that we go to that are, more kind of focused on people, families or people with disabilities, like the Abilities Expo and things like that we go to. It's great because you get to put a face to the name and, otherwise, us as the analysts, we really only get to see the families when we do a home modification visit. And otherwise, it's just a lot of, phone work and emails. And so I really do love to see the faces for sure.
So I can tell you that in this neck of the woods, there is going to be a transition fair at Booton High School on April 24th. And I can send you the flyer. The tables
Yeah,
are free.
please do. Yeah, please do. I was
So
actually just
maybe
at a
we'll,
transition fair in Burlington County, I think, a few months ago. It went really well. And, I think we are a perfect kind of program for that because I mentioned sometimes that while most kids' services end on their 18th birthday or their 21st birthday, we go through to their 22nd birthday. So I think that kind of makes us first of all, unique, unique in the state of New Jersey, but also it's a good transition program, while you're figuring out how is my child going to go from child system care and like, or whatever, to adult services, we can be helpful in that because while you're figuring all that out, maybe the things happen and you need us to cover that. Yeah, so we are excellent for that.
absolutely. At Special Child Health Services too, we end at the 22nd birthday. And so people will say, well, who comes in after you?
Yeah.
And
Once you're an adult, it's
thank
like,
you some
much harder.
resources.
Yeah, it's a whole
Yeah.
other set of resources and they are, they are broader in some ways and more limiting in others, like it's like a lot of scattered, lots of little things everywhere, but trying to piece
Right.
it together for services is difficult as an adult.
Well, the nice thing is that the council, there's no limit. We help families who have family members of all ages. Just want to do a shout out. Is there any more questions for Amy? We'll have a council table and Special Child Health Services will be both at that booth, and it's going to be a pretty big transition fair.
Awesome.
So I know a lot of professionals had signed up for this, so hopefully they got what they needed.
I hope so. Yeah, you let me know.
Gabrielle or Alicia, anything to add?
No, you
No?
mentioned I'm just trying to think of all the things coming up, Margaret. You mentioned the transition fair.
Yep. Oh, and
Um,
also I'll just reiterate, next month, even though oftentimes in the emails, I always say, we're always the third Tuesday of the month. Next month will be the third Monday of the month. And that's going to be our in-person meeting on Monday, March 18th at 7 p.m. at Wegmans. And once again, I know that Kyoko put it in the chat. Please, if you attended this meeting and like to hear more, feel free to just send us an email and say, add me to your mailing list, and we will let you know about all of our meetings. Okay, looks like no more questions, so we're going to be able to get to bed early tonight. So Amy, thank you so much for letting everyone know about the at our office we call it CICRF.
Yes,
Um,
probably a better way to refer to it.
well, you know what? We're called the Regional Family Support Planning Council, so
You
our
know?
name's not that much better.
Yeah.
So, all right. Well, good night, everybody. Thanks for your attendance. Take care.
I thank you.
Bye-bye.
yeah,